Odisha state is particularly vulnerable for zoonotic diseases, neglected zoonotic diseases, and also the emerging infections that has got zoonotic origin. The reasons being, number one, that Odisha's existing animal and human interface, and because of the development that is happening in the state, there is more of human and animal interface because the urban areas, when they are developing, the peri-urban areas are also extending its geographical limit. So peri-urban areas is getting influx from the rural areas, and mainly the milk supply, meat supply, poultry and all others. So that makes more human-animal interface, and that is causing this problem of zoonotic diseases. Unfortunately, Odisha's position or priorities in relation to these diseases is not very visible. But very good thing is that with the PHFI's initiative and with Kids School of Public Health, Bhubaneswar, they have started this research work on identifying the research priorities in zoonotic diseases, and also conducting research studies to create evidence for policy making and also advocacy. So efforts are being made both from the government side now and also from the other players. So although we do not see very much in the policy documents this priority that is given to zoonotic diseases, but it is also observed that the government programs like NBB DCP, they are also looking at some of the zoonotic diseases in that. But in general, we lack a clear-cut policy directions and the interest, particularly of the professionals, both from animal health side and also human health side. So with this scenario, there is a lot need to be done. The newly emerging infections are having 60 to 70% of animal origin. So we have to give definitely importance to these diseases. In that, what priority I will set is, first thing is data collection. This data collection is required. We don't have enough data to really advocate for it, and also there is evidence, we need evidence to put before our policy makers, our administrators and also the professionals themselves. So we need give emphasis on data collection, appropriate data collection. We need also frequent interactions between the animal health and human health. We need also a type of, I would suggest that brainstorming sessions, a think group can be created, and that will brainstorm time to time to bring in recommendations that how we will move in terms of collection of the data and also what types of research is required and how best we can implement these aspects. So my emphasis will be that on data collection, surveillance, we have to improve the surveillance, and also brainstorming sessions, more of inter-sectoral collaborations, more meeting interactions, and conducting research specifically to get appropriate evidence. And of course, we must create some good case studies and learn from the successes as we have been doing in multiple centers through PHFI. So that will be my priorities for Orissa state.